My name is Hank Urban, and I'm currently a resident at Point 47 in Brooklyn Center. I have lived in Minnesota since May of 1996 and moved from Louisiana after college graduation. I moved here because of the culture of valuing others and the goal of having a better life. I have left and returned to Minnesota several times because of the quality of life is high. I've called Minnesota home for many years, and since 2011, I have accessed HIV supportive services like the Red Door Clinic, Open Arms, and Clare Housing. These organizations have made sure that I and my neighbors are safe, healthy, and housed, which benefits all Minnesota communities. Our state is a welcoming place to live. I have lived in Minneapolis, Golden Valley, Plymouth, New Hope, Robbinsdale, and now Brooklyn Center. Without continued HIV service investments, Minnesotans across the state will lose access to vital resources. Referencing the Minnesota Department of Health's 2023 Prevalence and Mortality Report, there are Minnesotans living with HIV in every legislative district. It doesn't matter how you cast your ballot, our state lawmakers have a responsibility to prevent the spread of HIV and represent Minnesotans living with HIV today. Minnesotans who are skilled and diverse will lose access to stable housing, healthy food, vital medications, and mental health support. But when all of these things come together, we thrive. We know that the $9 million in continued HIV service investments are needed to meet the needs of our communities, which the governor's $6 million allocation will not fully meet. Today, I'm advocating for $9 million, a $9 million investment in HIV services to extend the lives of Minnesotans and to make HIV a manageable disease like so many others. Thank you for listening to my testimony.
Thank you so much for your testimony. To the next testifier, please introduce yourself for the record and proceed.
Hi, my name is Madeleine Hammerlund. I'm the HIV Housing Systems Advocate. I'm reading the testimony of the HIV Service Prevention Advocate. Thank you to members of the committee. My name is Terrell Ewing, and I have lived in Minnesota most of my adult life and spent my childhood summers on family farms in northern Minnesota. My mother grew up in both northern Minnesota and Minneapolis, meaning Minnesota has always been an integral part of my entire life. I first moved to Minnesota to be a Northwest Airlines flight attendant and live near my family. A few years later, I was diagnosed with AIDS, given 2 months to live, so I returned to my native California to be with my immediate family. I returned to Minnesota about 10 years later in 2008 to be close to my auntie, who became an important mother figure. During this time, I found myself living in a small rural town in greater Minnesota. It was only meant to be for a year or two, but I ended up calling Wadena County home for the next 15 years. I guess you could say you can take the girl off the farm, but you can never take the farm out of the girl. At the almost 90 years of age, my auntie still lives on that same farm in Verndale, Minnesota. Since 2008, I've lived in Verndale, Wadena, and at present in the Mill District of downtown Minneapolis. In rural Minnesota, we have had to provide transportation to larger urban hubs for those who need medical care necessary to live with HIV. I've acted as an executive director to an organization that provided 15 support groups in 2 states, creating community and reducing isolation for Minnesotans beyond living with HIV. Because Minnesota cares, we are a leader in the Midwest, and our HIV services is one of the ways we can show we care about our neighbors and our future. In the last 30 years of my being HIV positive, we've come a long way. I would like to remind those in the room that while you may not think you know someone with living with HIV, you likely do. I've heard stories of people being HIV positive due to numerous factors, including blood transfusions or IV substance use. We've learned that prevention is our most effective method to reduce cases and support those living with HIV. However, it can still progress to a life-threatening illness. HIV medications can cost upwards of $4,000 per month, along with multiple doctor's visits. Living in greater Minnesota, I've witnessed people living with HIV who, due to many factors beyond their control, go without medication or HIV services. Viral suppression is necessary to continue to reduce new infections. Without viral suppression, the number of new cases in Minnesota will grow. Today, I advocate for $9 million in HIV service investments for rural, urban, and suburban Minnesotans living with HIV. Now more than ever, we must do what is needed to support a future where all of us thrive. Thank you for providing me time to share this testimony.